All right, good afternoon, everybody. I am Robin Littlewing Sigo. I am the treasurer on the Suquamish Tribal Council, and I'm also I was a mental health counselor for a while. I have a master's in social work, and health policy is something I'm very interested in, as well as community health. And I'm really happy today that I get to be joined by Lisa Pratt from our wellness program and also Barb Hoffman from our community health program. And it's so nice to see everybody here. We're going to go through a couple of things today. And just a reminder that if you can mute your phone when you're not or your device, that would be wonderful. And Sarah, do you want to go through the slides one more time so that we can, just for the new people that just popped on, although I feel like I've been on calls with all of them before, so they kind of know what they're doing. And
Sure.
again, if you have any questions, feel free to put them in the chat.
Yeah.
And actually, I guess before we do that, we've got Tribal Elder Delore Mills here, and she's going to do an opening blessing for us.
Okay, ready? Is everybody ready? Join me in a prayer. We thank you, Lord, for your presence. We thank you that you're always with us. We thank you that you've been keeping everybody healthy, and we're minding all of our rules and regulations. And we thank you so much for everybody, keeping everybody healthy. We love you and praise you and thank you for your presence here. We can call upon you anytime, and you just are here. And we thank you for this privilege of prayer for this meeting. In Jesus' precious name, amen.
Amen. Thank you, Delore. All right. And Sarah, if you want to show the slides just for a minute to kind of to get us started, that would be wonderful. All right, staying healthy in a time of COVID-19. I'm really excited to be doing this. This is something that our EOC office had this great idea of doing more community health check-ins, and we can do those virtually and work on getting more comfortable with this platform as we look at making sure that we keep each other safe. And we've been really impressed with the number of people who've been able to join us, especially during council meetings and during comments from the floor. So we're hoping that this might be a really a great format to get people more involved in some of these things, and also to stay social and get to see people's faces. Sarah put together some really great technical tips here. So if you are working on a desktop today, if you look over on this slide, you can see a yellow arrow that's pointing up, and it's pointing towards that little thought bubble there. And that's a great way to ask your questions. We've already got a couple of ones in there. And Nancy said what a cool woven mask that was on the cover, the cedar one. Those were designed by Joey and Danita Holmes, and they've been commissioned by a couple of different museums and things to add those to their permanent collection. They have both cedar and then they also have cotton on there, and they can be form-fitting to your face. So those, I feel like, we've seen some really amazing innovations during this, and some of our artists have really gotten to explore new ideas, and that's definitely one of them. When you're looking at who you want to see talking, you can look at the top. That blue arrow that's pointing up will let you know. You can see just the one person who's talking, or you can see everybody who's on the call. You can also see if people have their camera off, maybe they've called in or they just don't want their face on there, that you can just see the people who have active cameras. And then on the bottom there with that orange arrow, you can that's the mic location. So if you have a chance to mute your mic, that would be wonderful, unless you have a question. And ideally you can put it in the chat, but we understand that if you're on the phone that we might have a longer conversation about about what that's, or we might have another way for you to reach us. And then we also have the technical tips for if you're on the phone. It's got a little bit different screen here, so you can still see we've got the yellow arrow that's pointing up towards the thought bubble and the mute button there with the orange one pointing down. And then it looks like, and do we have Barb Hoffman on the line? Barbara Hoffman? There she is. Yay, welcome, Barbara. Oh, can we hear her? Oh, you're on mute, Barbara.
Sorry, technical difficulties.
Yes, those definitely happen. And I feel like everybody's gotten so compassionate about doing those, about handling those technical difficulties. So definitely appreciate that. So I think before we get started, I would love it. Barbara, if you could just introduce yourself. I think everybody on here knows who you are. However, we're going to be recording this so that it's accessible by other tribal members and community members. So I would love it if you give us an introduction about you. And then Lisa, I'm coming for you next.
All right, so I'm Barbara Hoffman. I'm the community health nurse here for the tribe. I've been here for a little over 18 years. It's been my privilege to be the community health nurse for that long. I've learned an incredible amount of things coming from here, especially from my elders who I adore. I have a doctorate in community health, and it is being tested as we speak for what's going on in the world today. So that's me.
Thank you. And Lisa Pratt, could you introduce yourself?
Yeah, so I'm Lisa Pratt. I'm a psychiatric mental health nurse practitioner working over at the Wellness. I do any number of tasks over there, and sometimes I'm asked to speak on strange Q&A webinars. But yeah, like Barbara, I didn't really think that any of my nursing training would ever come to use in a pandemic, but here we are.
Well, we're so grateful to have you both with us. Did we want to start with some questions? We had some people who sent in questions at the very start or before this even got started, so we're going to answer those. And then again, we've got some over in the chat as well. And are those on a PowerPoint, Sarah? Wonderful. We're going to share Sarah's screen so you can see what those are. All right. Well, our first question is, where can tribal members get masks? And are they free or low priced? And now that they're required? And I'm going to ask Barbara Hoffman to talk a little bit about that.
So we do have masks. The Human Services Department will have them at their regular scheduled days, which is Monday morning, Wednesday afternoon, and Friday morning. And they can come and get them then. They should stay in their cars and call from the parking lot, just like for vouchers, and that's where you can get them. And they are free.
Wonderful. And then it looks like Wellness has some also, Lisa?
That was news to me at the beginning of this, so it sounds like we're going to have some over at Wellness. But that's the extent of my knowledge on that.
All right. Well, we will, so there's definitely some available. You can always email COVID questions at suquamish.nsn.us, which gets answered regularly by our EOC office. And We're also at the Suquamish Foundation going to be distributing some for low-income community members and tribal members, and we're going to be looking at putting some of those at the food pantries that are around, the free food pantries that are around town, and food banks and things like that. But you can reach out to us via that email address, and also feel free to just message me at any point and we will point you in the right direction. All right. And then since we're talking about masks, we had a question in the chat about, are masks effective? They're concerned about getting conflicting information. Barbara?
Yes, there is a lot of conflicting information out there. The consensus, however, from the World Health Organization, from the CDC, and from the Washington Department of Health is that masks do make a difference. I know there's a lot of information out there on the web that says that masks are not good for you for long periods of time, that you're breathing too much carbon dioxide, those kinds of things. As far as we know, that is actually not true. There has been a great deal of research done about surgical masks. Of course, not a lot done about cloth masks, but we are making the connection that people can stay in a medical mask for 12, 14 hours at a time and they have no issues. The only time that's an issue is with certain people who have probably emphysema or COPD, something like that. They might not be able to stay in a mask for very long, and so those folks are able to not have to wear a mask. There's no special kind of mask, anything that covers your mouth and nose. Hopefully, the more fitted, the better, so that you don't have a lot of leakage around it. But otherwise, it can be pretty much made out of just about anything. T-shirt material, cotton, many, many different things.
Oh, great. And my understanding is that what you're trying to do when you have the mask on, what I've read is that it protects others from you and the droplets and moisture that you are, that you naturally kind of do. It doesn't even have to look like anything, right? You're always kind of projecting these, like people who are singing together. There's been several groups with choirs and things like that, or exercising together, those kinds of things where you, you know, I keep hearing them referred to as droplets. Would that be an adequate term?
No, that's a perfectly fine term. So as long as you, even just sitting next to each other and talking can cause there to be droplets, you know, on any given, at any given time. Singing in particular does seem to have more droplets. So my mask is going to be helping you. So when I have a mask on, anything that I have going on, if I happen to cough or sneeze, or if I am just talking to you and droplets are going in the air, my mask is going to keep that from happening. So your mask is going to keep me safe. So that's the reason that we are recommending everybody put masks on that is able to, is because when one person has a mask on, it's safe, but it's much safer when both people have masks on.
Great. And then my understanding from being on a couple calls with the school district, as well as talking to the state superintendent, is that masks are going to be required in schools this fall. And so I'm wondering if Barbara or Lisa, if you guys could talk a little bit about how to get our kids used to wearing masks if we have elementary age kids. I know I have almost 11-year-olds and it's not their favorite thing, especially for one of them with some sensory issues. And so we're just trying to have her wear it a little bit every day to kind of get used to it. And then if you could also talk about the age that they're encouraging kids to start wearing masks.
So my understanding is that under 2, we should not be putting masks on anyone under 2. And under 5, we have to be able to supervise them very closely, and they have to be able to take the mask off independently, so that's, you know, if they start to have problems breathing. I think you are absolutely right with what you are doing. Getting them used to that at home on a daily basis is going to be one of the things that is helpful. Wearing a mask for an entire school day is going to be a challenge probably for some kids, especially if they have sensory issues. We might think about getting face masks for some of those kids if it's just too much for them to wear a mask all day as an alternative. The other thing is if everybody else is in a mask, then the child is probably relatively safe, but then that becomes an issue when she doesn't have to wear one and I do. So I can see that becoming a big issue.
Right.
I think of it sort of like a seat belt or pants. You know, no child really wants a seat belt, and lots of children would probably prefer not to wear pants. But we wear pants and we wear seat belts, and when everybody else does it, and that's the expectation, it makes it easier. Having a really cool, fun, cute superhero or cartoon mask. I mean, there are masks that you can purchase for not a lot of money that are really pretty fun. I bought my daughter a Lilo and Stitch mask because that's what she's into, and it's adorable. And or they're not hard to make, so letting the child potentially choose their mask. I also saw an ad for like Crayola is coming up with a package of disposable masks that could maybe be worn a couple of days and then tossed out. Of course, we don't like the waste, but they're bright colored and they're cute and they're lightweight and probably pretty easy to wear. So kind of letting the child acclimate to the mask now would be a really good idea. Lots of kids just haven't been leaving their homes and therefore aren't wearing masks in the community. But starting now could be helpful.
Yeah, we've also found that having a couple different kinds really helps. So we might have some of the disposable ones and also a couple of the other ones. Because I know even just when we're in council meetings and we've got an 8-hour meeting and we're wearing them, I usually bring an extra one so I can swap out in case they start to feel uncomfortable in any way or they start to bother my nose. And then I always think of, you know, all of our amazing health providers who wear them all the time. And then I'm quite sure that I can get through wearing them. All
Yeah,
right.
that was going to be, sorry, I was a little bit late. Hey, everybody. My question, so Barbara, I've been posting a lot of very pro-mask stuff on Facebook, and I do get messages and comments about, well, I can't wear one because I get claustrophobic, or this, you know, examples like that. So what, and you might have already touched on this, so I apologize if it's already been covered. What is the, if I were to recommend people, like, okay, if you're claustrophobic, wear a face shield. Is that a viable alternative? Or like Lisa, I believe that was Lisa that was just talking, I love the idea of the superhero mask. Like, because I mean, I'll walk, you guys already know me, I'll walk around in an Iron Man mask all day long if you'll let me.
Deadpool, Sammy.
So yeah, or Deadpool. Like, so is that a viable alternative? Will masks like like a grinder face shield or something like that, will those trap droplets in effectively?
So when I use a face shield, I also wear a mask.
Yes.
But for young children and for someone who's maybe very, very claustrophobic and can't get past that, a face shield is going to be helpful. I don't think that it's as effective because you've got this shield, but there's still airflow that can come underneath it. But it does going to block, if you're very close to somebody, it would block somebody's coughing or sneezing or something like that.
Yeah, because that's the one thing I'm getting a lot of because I have been posting a lot. I've been posting a lot of pro mask stuff, and that's everyone that doesn't want to wear masks come back is, well, I get claustrophobic, or they'll message me on the side and say, well, they trap CO2 in, or, you know, and it makes me panicky. And and like Robin stated, like, yeah, like I also bring a couple masks. Me and Robin both swapped out right about the same time the other day at council, where we're wearing the thicker one with the filter built in, so it's multiple layers to breathe through, and eventually it does get kind of moist and it does get kind of like hard to breathe through. And then I swap it out for a basic surgical mask just to give myself a little bit of break, but also still protect the people that I'm near. And so I'm just looking for other alternatives to tell people when they're just absolutely adamant that they cannot wear one. Like what are some what's the next best option? I feel like most people can wear them.
And I think that that's true as well. There's a lot of negative messages out there about masks. A lot of people saying, you know, that they're bad for you, that kind of thing. It's hard to tease out what's true and what's not true from some of those things, because some of them look like they're coming from very reputable places. And so I very much try and stick with the CDC, the State Department of Health, and WHO, all of whom are very adamant that masking is necessary.
Well, I try to just give data from other countries. I mean, other countries have been doing it for months now, and their numbers are like, they're getting like, full countries are getting 100 and something cases a day, where we're doing like 40,000. So, I mean, the proof is in the pudding.
I also think that, you know, maybe as Americans, we're sort of spoiled or prone to thinking as individuals rather than a community. And so my thing has been to really talk to people about the fact that, yes, a mask is uncomfortable and I don't like wearing it, but this is something I can do for my community. I can do this for whether it's my community here at the office, whether it's my community in general at Suquamish, whether it's my community at church, whatever that community is, I'm doing my part to keep that community safe. And also, I think just what Robin was saying about, you know, and Lisa, about wearing it for short periods of time at home to get used to it. If you just put it on once and say, oh, I don't like this, you know, it's like trying a new food. You need to try it several times before you might like it.
I remember Barbara taught my kids in the early learning center about, you know, no thank you bites, or that you have to try something. Is it like 5 different times before you might like it? How many?
5 to 10.
5 to 10 times. And so we just have to keep doing it. And again, what I want to stress to our tribal members is that we have people who are reviewing this every single day. And we talk about it all the time. And I'm so grateful. I reach out to Barbara when I have questions, and she's been a wealth of information. I'm going to move over here because I see Cindy is raising her hand with a question.
Yeah.
All right.
Get this unmuted. Okay. Yeah, Sammy, I was just going to say it can be real easy to say, oh, I don't like it. But and the first day was, you know, wearing it for a lengthy period of time can maybe be a little bit uncomfortable, but it just takes getting used to. And it is so much better than a ventilator or making someone near you sick. And that's what I try to focus on.
I think that's absolutely true. Thank you for saying that, Cindy. I mean, again, we're community based, so we understand doing things to keep other people safe. And I think that's something that other people in our state and in our country can learn from Indigenous people and small communities who really band together to stop this. Lena, did you have a question?
Yeah, I just kind of wanted to add on that too. And you know, I do understand that I also have a lot of family and friends who have anxiety and things like that to wear the mask. But one thing I've noticed too from being out myself at grocery stores or whatever are the people that are opposed to mask wearing because they feel it infringes on their rights. They don't like being told what to do from the state and things like that. I actually had a little girl with her mom wearing a mask question her mom, why isn't that lady and her son wearing a mask? in line at the grocery store. And it started to get kind of heated between those two parents. And that's the real climate out there, just on a simple thing as wearing a mask. And so,
Right.
you know, how do you react to that or react to that? And there's kids listening right there in front of you. And it's very confusing. It's very touchy, you know.
Yes, and I think that there's definitely some concerns about, I mean, there's concerns about confronting people. I saw somebody yesterday and he had his mask under his nose, which makes me nervous. And, you know, so I have to think about how I want to say those things. And there's definitely ways to do that. And sometimes, like, I'm sure at some point our kids will say, well, so-and-so wasn't wearing a mask. And I like to very clearly say, our family wears masks. Our tribe wears masks. And so you make that about you and what your family does, what your community does. And I think that that's a really great way to say that, you know, and you can also add something to it. I like to have, you know, just kind of go-to statements that I have where I don't want to get in an argument with somebody about it. So I'm just going to say the part that I feel like I need to say, which is, our family wears masks to keep everyone safe, and then let it go from there, because it's not really worth it to get in a big fight with somebody else about it. But it's okay to stand up for yourself and to advocate for your family and make sure that people know, because other people are feeling that too. And it's difficult to stand up in those situations. And you've seen some really aggressive arguments on social media about some of these things. I mean, we've seen rallies and protests about them. So it's unfortunate that masks have become so politicized, but it's our best source of science and it's our best way to protect each other if we can't stay at home. So I want to move on because I think we have some more questions, but I certainly feel what you guys are feeling, and I want to make sure that you know, we're equipped with able to say what we need to say to support ourselves and our community and protect them. All right, what do we have coming up, Sarah?
There were a number of questions about testing and about when is it useful to get tested, when is it too soon or too late, what about false negatives?
All right, Barbara has heard this question from me before, so I'm excited to hear. I mean, that was a lot of great information for me.
So in general, testing is done with a PCR test, which is something that's been used for a very long time for things like flu and other kinds of viruses. And so the incubation period for COVID-19 is generally 2 to 14 days. There's some information out there that says the best time to test is between 5 and 8 days. In an asymptomatic person, it's very hard to know because we're just not sure when the best time to test is in someone that's asymptomatic. When people are symptomatic, they usually get tested as soon the day or two after they start having symptoms, and that's a perfect time to be tested. There's a lot of confusion, I think, about the difference between a PCR test and an antibody test. So there's a lot of information out there about antibody testing. And from what I understand, we're still not so certain that it's accurate about its accuracy. When we first started COVID, we had a lot of antibody tests come out, and not all of them have proven to be very effective. And so at this point, the state is not looking at antibody tests to say that somebody is positive. It's only a PCR test.
Okay, so a PCR test would be the one that we go in and if we're worried we have COVID, we go and take a COVID test. Like in layperson's terms, we'll go take a test, and that's a PRC test.
PRC test, and that's a nasal swab.
Okay, and that's a nasal swab. And it takes anywhere from a day to 2 days to get those results back?
If for us, it's taking 1 to 2 days. For other places, it's taking a lot longer. It depends on what lab you're using. We are driving
Okay.
the UW every day, so we are getting them back fairly quickly. Antibody testing we are not doing.
Okay. And the antibody test, I just want to clarify real quick. The antibody test is to test in your system to see if you've ever had COVID.
So it's going to look for antibodies. So there's different kinds of antibodies. Some antibodies that happen when you are actively sick with something, and some antibodies that happen after you have gotten well. However, that test is not specific enough for us to say one way or the other as far as whether you have it now or you've had it in the past. There's just too much. It's just not at a point where we can it's that useful for us, because for one other thing is that we don't know if having antibodies even protects us from getting COVID the second time.
Okay. All right. And then, so one of the things, I know I brought up this question to you and to Sherry, and you guys were both really helpful. We talked about, like, if you were possibly exposed to it, either by going to a rally or a protest or even a graduation, something, or if somebody that you were around turned out that, I mean, I guess let's start with ones where nobody has any symptoms, but you were you were near people, you were masked up, but you were near people. What would be the ideal time to get tested for that?
So I'm not sure that there is an ideal time to get tested in that particular situation. If both people are masked, then your risk is relatively low. However, if someone decides they want to be tested, you want to probably look at between 5 and 7 days after the exposure being the time that you would the most likely to be positive.
Okay. Thank you for that. All right. Do we have any other question? I see Cindy's got her hand up.
I had to have a test because I went in for surgery on Friday. And so just in case any of you come across people that might be leery of having it, it's uncomfortable a little bit, but it's not painful. So don't be worried about that part of it. I just wanted to help
Somebody
that way.
described it to me as like getting like a strep throat test, but in your nose.
Right. And it's also not, I mean, I've seen some videos out that talk about doing the nasal pharyngeal test where they have a very long, and this is just into the nose. It doesn't go to the back of the throat. It's not nearly as comfortable as that.
Oh, okay. Good to know. All right. What's another question we have there, Sarah?
So there were a lot of questions about the impacts of being isolated for so long, and you know, what is it? Is there a traumatic impact of having that? Are there mental health challenges? Are people experiencing anxiety? And if so, do you have any thoughts about how to alleviate those symptoms?
I'm going to let that be Lisa's question.
Yes. There are definite mental health impacts. Kind of one of the things to think about is our brains are pretty good at doing really hard things for short periods. Really hard things we can do for about 3 weeks before we kind of want to give up. So think about people when they stop smoking or join the gym after New Year's or decide they're going to do the keto diet. The kind of average time that people resume their previous behaviors is about 3 weeks, because that's how long our brain is able to sustain something really, really hard. Of course, some people can sustain things a lot longer, but this is just our general averages. And so we're being asked to sustain something incredibly hard for far longer than 3 weeks. And so as that continues, we do see increasing anxiety, and increase in depression, increase in substance use. And so, you know, people across the country are really starting to struggle, and it's anticipated that people will be struggling even more, when it's rainy and dark again, this fall and winter, when we're expecting that we're going to be seeing more cases. And so with that, there's lots of things that people can be doing. I tell the folks that I see that, the trio of things are exercise, a healthy, regular diet, like don't skip meals, and eat healthy. It doesn't mean you need to start only eating vegetables or anything unless that's what you want to do, but just caring for yourself, feeding your body, and then sleep. Regular sleep wake. My work day has shifted a bit, and so I don't have to get up as early because I'm not commuting, and so I stay up a little later. But I don't recommend that people are staying up until 2 a.m. or 3 a.m. or 4 a.m., gaming or watching Netflix and then just sleeping all day. I suggest that folks set a bedtime and set a get up time and that they stick to it. But that the kind of the single best thing that anyone can do for anxiety is to get their heart rate elevated for about 20 minutes, about 4 times a week. And that will decrease the anxiety significantly. And then there's lots of resources online, meditation, mindfulness, there's podcasts, there's apps, there's mental health counselors available at Wellness that folks can work with to kind of help deal with some of the stressors of being isolated in a home with children that aren't in school and extended family and just closer quarters than normal. And then the increased stress of not knowing what's going to happen with the economy, some job insecurity, financial insecurity, and then the worry of loved ones getting sick is pretty real too. So, I recommend that folks reach out to, Wellness before depression or anxiety gets significantly poor, and seek help sooner. But that kind of the basis of your health pyramid is going to be the, sleep, exercise, and nutrition, and not increasing your substance use.
Yes, I think that's a great way to think about it, because I think a lot of times, at least while I'm at home, like lots of people are posting all of these different things they do, and then there's a tendency to compare yourself to other people and what they're doing. And, I've seen great posts where people have started an exercise routine and they're doing great on that and they've lost weight. And then other people are like, no, I'm gaining weight while I'm on this. And I like to remind people that whatever you're doing to survive this, as long as it's as healthy as possible, as healthy as you're capable of right now, that's probably the best thing to do. If you're not resorting to really destructive behaviors, then what we need to get through this time is we need to survive. One thing, Lisa, as a parent of 2 teens and 2 preteens who often stay up late gaming and sleep the majority of the day, I guess I wonder if you could talk a little bit, and maybe I have stayed up binge watching shows late at night and slept in. I'm wondering if you could give us some signs to look for, like, so if that gets excessive, like at what things should we be looking for in other members of our family or in ourselves of when that becomes a problematic behavior versus when it's kind of you're letting off steam and you're having a late night or those kinds of things.
I think as long as it's kind of occasional, then a late night is absolutely fine. And, teenagers are kind of set to stay up late and sleep in late. You just want to make sure you're seeing your teenagers, that they're not sleeping until you go to bed the next day, and that it's not totally flip-flopped, only because you want to make sure that you know who they're talking with online when they're gaming and what they're actually doing. And, just having kind of a schedule to help with some normalcy here, whether that's how it was when we were trying to have school or whatever our school is going to look like this fall, having some sort of, your 14, you can sleep till noon. That's fine. But at noon, you get up, and that's your breakfast. So you're gonna eat at this time, and then you're gonna do a couple chores, and you're gonna maybe read a book, and then you can do what you want as long as I see you again at some other point, and then have some sort of set bedtime, which could be 2 a.m. if that's when all their friends are up. I know that there are some teens that game with kids that live in other countries, and that's really cool. There's some benefit to that for sure. And so those kids are in Iceland or whatnot, where it's 7 hours earlier or later, I don't remember, but just setting their schedule so that you're able to check in and kind of know what's going on, and then just watching for isolation, watching for just signs of irritability, and just if your children aren't acting kind of how they normally act, just making sure that you're keeping the communication open and having conversations about how they're feeling. Limiting social media, I think, for everybody is a good idea, and also limiting the amount of news, because there's a lot to read about, and I get totally sucked into the rabbit hole of both COVID news and Black Lives Matter news and government news, and a lot of it's pretty dismal. And so limiting the amount of kind of media and news that people are consuming is going to help with your mental health a lot. And then seek out positive stories, seek out the people that are making a difference, whether it's with social justice issues or the heroes that are coming up with new ways to keep patients alive that are intubated, or research the folks that are working on vaccines. Go look at Bill Gates's foundation's website. And so balance kind of some of the overwhelming and dismal news with seeking out positive stories. And I make my daughter do that as well as I do too, because we all get kind of overwhelmed, but we want to be informed. And so it's hard to balance it sometimes.
I think that's a great one. And I think, again, when we're looking at things like the Black Lives Matter, Native Lives Matter movements that are going on, that sometimes people feel overwhelmingly like they need to constantly be posting about that to amplify that message, and that they need to constantly be working on it. But sometimes we also need just those small moments, those like funny cartoons. Like it might be like we've started movie nights here with my kids, and we also really like The Simpsons, so we'll watch The Simpsons together. And just finding those moments where we get to cuddle up and actually laugh together, I think those offer some really great moments, and that's what we're looking for. I know Cindy is one of our school board, or she's the school board president for North Kitsap, and Barb and Albie and I were on the virtual meeting not too long ago about the reopening, and I think, we're looking at, I really appreciate that the North Kitsap School District is looking at offering something different. So it might be shorter days, and really looking at getting back to some of those basics and not kind of leaving it so much to the parents, because I felt like there was so much when we talk about trauma and we talk about how how kids especially will remember this pandemic and this time period. I want them to remember that their family took care of them. And I don't want it to be them constantly remembering getting like harped on for doing homework and every little thing. That instead, the most important thing is, are they learning some things? Are they handling it well? What's their overall mental health? I mean, I know as the tribe, our constant conversation with the school board and things is we want to raise well-rounded citizens of the world. We want to raise well-rounded Suquamish citizens and Suquamish tribal members. And that's going to be the most important thing that we do. So sometimes we all need to get a break from all of those things.
Oh, yeah. And yeah, the amount of parents I've worked with around the guilt that they've experienced of not educating their children. And I just tell them, so like, nobody really saw this coming. I mean, we saw it coming, but not in the way it happened. And of course, the school districts weren't prepared, and we all did the best we can. And it's like, make sure that your child knows that they're safe and loved, and teach them to grow some tomatoes or change the oil in the lawnmower, and
Bake
they will
something.
be,
Bake some
they will
fruit.
be okay in the next
Yeah.
fall with whatever happens with schooling. The kids are going to be just fine. They didn't lose 3 months of anything, but to the parents to give themselves a break, that you're overwhelmed, they're maybe working or looking for work or not, but folks that think that they failed their children because they weren't homeschooling them, they didn't fail.
They
And
didn't
so,
make all the
yeah,
Zoom meetings or something like that.
yeah,
You don't have to make every single one.
yeah.
And that's okay. And I think that's an important part, is just being kind to ourselves and kind to our family and friends, and assume that we're all doing the best we possibly can. I want to get to some of the questions about, as we're talking about kids and parenting, is can we talk a little bit about if our kid wants to have a social distance play date with somebody? Because I know I've heard from a lot of people that their kids haven't seen other kids in a while, and that's starting to affect them too. So what does it look like to talk to another parent? And I'm not sure if Lisa or Barbara wants to take this. How do you talk to another parent about what their family is doing and your family is doing, so that you know if it's a good match to maybe try to have a social distance play date, or sorry, a physical distance play date? We're trying to use the term physical distance because we don't want to socially distance from people. We want to stay connected, but we want to be physically distant where we have things in place like 6 feet away. We want to make sure we're outside. We want to make sure that we have masks on and those kinds of things. So if maybe Barbara, if you want to go first and kind of talk about screening questions that we might ask another family or another person that we're looking to meet up with in person.
I think that the really important thing for that situation would be the masking, to making sure that that the people are comfortable with having masks on during whatever they're going to be doing, and also limiting the numbers of people that you're exposing yourself to. I think when we were talking, you used the term a pandemic family. So, so instead of having, five friends, different friends' houses we go to, maybe we only go to one or two, and we talk with those families about the fact that you're part of this, and they maybe don't have so many other contacts either, because as we make that broader and broader, then the more and more people we have to worry about making sure that they're taking all of the precautions. Being outside is a perfect way to do that as well. This time of year, we can do that. When it gets to be the fall, it'll be more of a challenge, but being outside, being masked, and limiting how many different sets of play dates we have, I think would be the things that I would consider.
Yep, that's my understanding too. And of course, you have to weigh the vulnerability. If you have an elder in the home that is vulnerable due to chronic health conditions, that very much might change the picture. And so everyone has to weigh that for themselves. But the recommendation I've read is that you would join the bubble of another family, or maybe two, which is going to be really difficult if you have children of various ages. I have one child at home, and if she has a friend who's also pretty much has one child at home, I could very much have a conversation with that family and say, hey, do we want to join our bubbles? And then our children could play, and we could agree to continue being very careful with our masking and physical distancing in the community. And then as long as it's outdoors, it would be relatively safe to socialize with that one family, and then maybe consider at some point adding a second, but keeping it pretty much like that. And those are things that are going to become more important. And I think that we're going to be reading a lot more about this here over the next few months, but kids are going to
Right,
need these.
as we were talking about earlier, right, it hasn't been so much a lot of outbreaks based on the rallies and protests that are going on because people are very masked up and they go home and they kind of follow those the best guidelines that we have. But
Mhm.
oftentimes with graduations and family gatherings, we get more calm, and we were talking, Lisa and I were talking about the psychology behind you kind of deserve something. Like, we've been in quarantine for 4 months now. We deserve to get to blow off some steam together. And often that looks like risky behaviors. And those risky behaviors are just getting too close, hugging each other, maybe sharing food or something like that. So we need to be careful of that. I
Or
want to be cognizant of time because it's almost 5:30, and I think this was scheduled to go from 4:30 to 5:30. And so I'm not sure if there's some questions. I had a couple of quick mask questions. Barbara, things like, should you be wearing a mask when you're driving through a Starbucks drive-through?
So I'm not sure that the Starbucks, some of the drive-throughs I've been through are not being masked. So I would put a mask on, yes. If the person in the drive-through is not masked, I would.
For the record, everybody at Starbucks is wearing masks, and they have
In that
and they
case,
have the plexiglass. Let's see. We had another question. When you're going to get gas, should you be wearing a mask?
it depends on how close you're getting to other people. I think if you can maintain a 6-foot distance, you're probably okay without a mask outdoors like that. The thing with gas pumps is there are millions of people touching those or thousands, hundreds of people touching them on any given day. And so making sure that you're really washing your hands after you pump gas and then not touching your face would be the more of what I would be concerned about with the pumping gas.
Okay. Irene just asked in the chat, should we be wearing gloves at the pumps? So it's wearing gloves or putting on hand sanitizer afterwards?
Yes.
Yeah. Okay. And then we also have one about that there's a holiday weekend coming up. We also know that a lot of Suquamish tribal members and community members will be attending the caravan for Stony. And so during this holiday weekend, a lot of people will want to visit family. How do we keep our elders safe? What's the best way in this situation to do some sort of gathering, but keep everyone safe?
It's really a challenge to get together with the entire family and keep everybody safe. And that has been one of the challenges with multiple members of one family coming together and then several people getting sick. So I think the standard things that we've been told, wear a mask as much as you can, stay 6 feet away as much as you can, wash your hands as much as you can, and don't touch your nose and your face. For folks that are older, that are more vulnerable, they might want to consider not going. If that's not possible, then making very, very sure that they are following all of those instructions. With like the rally for Stony, people that are that have health problems, it would probably be better if they stayed in their vehicles rather than getting out of their vehicles, just to keep that distance.
Okay.
So,
all right. Thank you for that. Were there any other questions that I'm missing or any things you guys want to tell us to wrap up?
I think, I realize, Miss Nancy.
Thank you. You mentioned sharing food. I was planning to take some food to friends and leave it on their porch and things like that. Is that still risky? I mean, if I'm not having contact with them, is it risky because I'm preparing the food?
So you might want to wear a mask when you're preparing the food. And then as long as you are not if you're leaving it on their porch, then there's no contact. So that should not be an issue for either one of you.
Okay, thank you. I mean, I have done that in the past, but I just started thinking maybe I should be doing things differently or not at all. So thank you.
And I thought I saw Cindy. Did you have your hand up?
Yes. I put this in written form, and I'm sorry I got distracted for a minute there. But when we're in an uncontrolled situation, say I have to go to the mall to pick something up for my daughter, or we're in the grocery store, and there's people, even though it's state law now, that are not wearing, is there anything we can do besides wearing our masks to protect ourselves? Just, I don't know, run away from people or what?
Right. I mean, yes, I mean, literally staying away from people who are not masked as much as you possibly can. I think also it's important to understand what the definition of a close contact is. That contact is 15 or more minutes within 6 feet with neither person wearing a mask. That is the standard we're using for a close contact to someone who is positive. So your risk in this grocery store is probably low. It's lower if both of you are wearing a mask. But so I think we can't control what other people are going to do, and even if it's state mandated by the state, nobody is enforcing it. And so you're going to have, we do the best we can with doing our own masking, staying away as much as we can from people, and washing our hands.
I think that's great information. One of the things before you get off the call, it would be great if you have a second to jump in the chat and let us know how effective this was. You can just put in a number from 0 to 10, 10 being really helpful, that you really liked doing this. Also, if you have any other topics or ideas for things like this, or if you'd like to see a kind of COVID Q&A once a month, please let us know, because we would love to, we want to make sure that we do that. We recognize on tribal council that sometimes, and with our, and at the government in general, that sometimes we are just working on things constantly, and we haven't always been the best at making sure that we let everybody know the whole process. We kind of just come up with the finished product, and sometimes that's not the most helpful. But please forgive us for that. We're trying to make headway, and we're going through something new as well. And so I've appreciated all the support we've had with that. But everybody is working really hard. And if you have questions on how those decisions get done, please let us know. And again, if there's something, I think wellness is looking at doing something later on in the summer, kind of getting ready for, seasonal depression, in conjunction with heading into, depression and pandemic times, getting ready for school, and how do we alleviate some of that? Because I know I'll be a little bit nervous sending my kids into a classroom again. So so we're looking forward to those. So please let us know if you have any topics that you would like to see us get to. And I want to thank everybody for coming. This was wonderful to see so many people.
Thank you.
Thanks for inviting me.
Yes. Thank you, Lisa. Thank you, Barbara. Thank you, Sarah and John, for always getting all of this stuff ready.
They didn't get to hear you.
Thank all of you. This has been very helpful.
Boy, everybody.
Thank you, Delore Hoyt.
Wait.